you have the never-ending heaviest period in the room. But do you really? Or you just think you do? Hi, I'm your local OBGYN. I love women. And how do you know if you actually have heavy menstrual cycles? Okay. This is tricky because, we're not there with you to see what kind of stuff is coming out. We're not weighing your pads. You're not in a study that has some design to figure out actually how much is coming out of your girl part. So this is really a big deal to communicate about. And the best way that we get this information is with a history. We want to know how long you're bleeding, how heavy it feels to you. Do you feel like you are discharging jello-looking clots, which tells us that there's more profuse, rapid bleeding going on when it does occur? The other things that we want to know are what kind of period products are you using? Because if you're using light products and you're bleeding through it, then guess what? It can't be that significant if you're saturating a panty liner. But if you are saturating through something more significant and you're going through super tampons, super pads, and you're still bleeding through to your clothes, that is important for us to know. In the office, we can usually do an exam if you're in the middle of that heavier bleed, as well as a finger stick hemoglobin to get a quick assessment. The reason this is important is I will generally see women with menorrhagia, which is this very heavy bleeding, in the office when they're in the middle of an acute bleed, or even more commonly sometimes in the emergency room when they're in some sort of a major bleed, okay? Other symptoms that can be a sign that you have significant bleeding are dizziness and lightheadedness. That is much more of a concerning set of symptoms because your blood count could be so low that we need to address it rapidly. So if you're having these symptoms, make sure that you're getting seen. If you're having significant symptoms like dizziness or lightheadedness, call your doc and see if you need to be in an urgent